On Katie Nelson's kitchen table, it's easy to find a metaphor.
It's always a puzzle.
But that's not what she spent hours searching for here.
I was just looking at the spreadsheet of the new plans that we are offered.
Nelson and her family are among the 30,000 Coloradans who will lose their health insurance at the end of August when Friday Health Plans officially goes under.
That left us to scramble and try and get new health insurance coverage.
It turned out that they didn't have enough money to continue for the remainder of 2023.
Vincent Plumel is with Colorado's Division of Insurance, which took over Friday Health Plans in late June, thinking that they could at least try to keep the sputtering health insurance carrier afloat until the end of the year, until the state took a closer look at the books.
The financial projections were worse than anticipated, so they weren't going to be able to finish out the year.
Now, families like Nelson's are allowed to go back to the market for a special enrollment period to find new plans that start when Fridays stop at the end of August. She's already picked out a new plan to kick in on September 1st, but in the meantime, she's having trouble with Friday.
They have denied an insurance claim for a prescription that has been covered at 100% all year.
A transmitter for her son's continuous glucose monitor. She says the sudden decision to decline cost her $180. Plumel says that shouldn't be happening and says anyone having an issue should get in touch.
Contact our consumer services folks right away and let us know the situation, any of the particular details, so we can dig into it and see what's going on.
So what still remains to be answered is, will Nelson and the others impacted have to meet a new deductible for the 2 months that they are on this insurance, or the few months left in the year? Only one carrier on the exchange, Kaiser, has agreed to honor customers' deductible from Friday Health Plans. Anthem, Cigna, and Rocky Mountain Health Plans have said that they will not honor deductibles. The state is now trying to work on a compromise solution for that. They hope to have an answer for that soon, using some of Friday's resources to be able to try to meet the deductible for folks. But a lot of people
That's so important.
It's a big fear for people.
30,000 people on that plan, depending on what they choose, may have to kind of meet their deductible again before the end of the year.
Don't get to choose when you get sick either.
No.
That's just
Many
it.
people, you know, it comes and finds you, and oftentimes in the worst of times.
Well, and you know, Katie said that she's afraid to go to the doctor after having that one denial of a claim. That's why the state's saying, make sure you get in touch with us if you notice something wrong. They're running Friday Health Plans right now. They are in charge of it. So they'll get to the bottom of anything that's wrong.
And also, you mentioned that it's important that you know about this. I mean, to be fair, insurance is something most of us, our eyes just roll in the back of our head trying to understand. And she had a broker.
Yeah, she has a broker. She says she's lucky. She got one notice from them at the end of June that said she had till the end of the year. But when the state made that decision to close it at the end of August, she hasn't heard from Friday Health Plans. And had it not been for her broker, she wouldn't have known. So the state really wants to make sure they're getting the word out there. Know that if you have Friday Health Plans, you have to have another option before September 1st.
Okay. Thanks, Steve.